Assalamu alaikum. It's a very important topic regarding pressure of the respiratory system. It's the topic of the respiratory system regarding pressure. Now I would like to discuss about these things in a very simplified manner. Okay, we know that the measurement of the airway pressure can be useful in mechanically ventilated patient. So, if a patient is mechanically ventilated, then his airway pressure measurement is very useful. The peak airway pressure, that means the maximum pressure measured as the tidal volume, is being delivered. We know that we calculate tidal volume. Tidal volume is about 6 to 8 ml per kg. So maximum pressure measured as tidal volume is being delivered equals the sum of the resistive pressure like flow and resistance and the plateau pressure. These things should be considered. That means peak airway pressure equal to resistive pressure, and the resistive pressure relies on flow and the resistance and the plateau pressure. How do you measure peak airway pressure? And what is a peak airway pressure means? It means the maximum pressure measured as the tidal volume is being delivered. So peak airway pressure means the maximum pressure measured as the tidal volume. So it depends on the tidal volume, and the resistive pressure depends on the flow and resistance and the plateau pressure. The plateau pressure is the pressure measured during an inspiratory hold maneuver. It The plateau pressure is the pressure measured during an inspiratory hold maneuver when the pulmonary airway flow and thus resistive pressure are both zero. It represents the sum of the elastic pressure and P. So plateau pressure is the elastic pressure and the P. So we have learned two things. Peak airway pressure. It relies on tidal volume. Peak airway pressure equal to resistive pressure, that means flow and resistance plus plateau pressure. In the plateau pressure equal to elastic pressure plus P. The plateau pressure is the pressure measured during an inspiratory. It measured during an inspiratory hold maneuver. This word is very high. Okay. So elastic pressure. Elastic pressure is the product. Elastic pressure is the product of lungs elastance. Product of lungs elastance and the volume of the gas delivered. Because elastic recoil is inversely related to the lung compliance. Elastic recoil is inversely related to the lung compliance. The elastic pressure can be calculated as tidal volume. Decreased compliance happens in the fibrosis causes stiffer lungs and higher elastic pressure. Stiff lung, higher elastic pressure, decreased compliance. Think about fibrosis. An increased peak pressure associated with unchanged plateau pressure suggests a pathological process causing an increased airway resistance, such as bronchospasm, mucus plug, endotracheal intubation. Increased peak pressure, bronchospasm, mucus plug, endotracheal tube intubation. Elevation of both peak and plateau pressure indicates a process causing decreased pulmonary complaints such as pulmonary edema, atelectasis, pneumonia, right mainstem bronchus. So increased peak pressure equal increased peak pressure. There may be normal plateau pressure and there may be increased plateau pressure. Normal plateau pressure is VMM, that means bronchospasm, mucus plug, and biting endotracheal tube. And the plateau pressure, that means increased plateau pressure, that means pneumothorax, pulmonary edema, pneumonia, atelectasis, and mainstem intubation. Right mainstem intubation. Assalamu alaikum. Now, in this is the picture of the inspiratory hold. I will try to show you in deeply manner. This is inspiratory hold and this is pressure, this is time, pressure, time, and in here the pressure increase, this is the hold, and in here there is pressure management. So inspirator hold, pressure, time, this is the time of holding, and in here there is pressure management. Look at this picture. Again, this is pressure versus time, and normal inspirator hold is this. This is plateau less than 30, and it is peak. Plateau less than 30, and high peak due to increased plateau. High peak due to increased plateau. This is the condition. Pressure, time, peak. There is increased plateau more than 30 when it happens due to decreased respiratory compliance, and the causes are pulmonary edema, pneumothorax, and abdominal compartment syndrome, decreased respiratory compliance. This is high peak due to increased plateau, and in here this is high peak but normal plateau pressure. Normal is less than 30, high peak but normal plateau pressure. It is due to increased airway resistance. Biting the that means biting the endotracheal tube, bronchospasm, and mucus plugging. Biting the endotracheal tube, bronchospasm, and mucus plugging. So this is the condition. Okay, trauma. If I am looking at the location 1 to 3, 3 to 6, 9 to 12, and any level 1 to 3, 3 to 6, 9 to 12, and any level. In 1 to 3 level, in 1 to 3 rib level, subclavian vessels, brachial plexus, mediastinal vessel. Subclavian vessels, brachial plexus, and mediastinal vessel. 3 to 6 is cardiovascular, and 9 to 12 is intraabdominal, liver, spleen, kidney, posterior ribs, and any level is pulmonary. So rib 1 to 3 subclavian vessel, brachial plexus, subclavian vessel, brachial plexus, and mediastinal vessel. 3 to 6 is cardiovascular, 9 to 12 intra-abdominal, liver, spleen, kidney. Posterior ribs 11 to 12 and pulmonary. Now flail chest. Flail chest. Flail segment paradoxically moves. Flail segment paradoxically moves during inspiration and decrease inspiration, so hyperventilation of the affected lung. Paradoxical movement. Paradoxical segment. Flail segment paradoxical moves in deglutition and decrease inspiration, hyperventilation of the affected lung. Hyperventilation of the affected lung. And in here flail segment paradoxically moves out of out paradoxically moves out during expiration, paradoxically moves out during expiration, and increase dead space in the affected lung, increase dead space in the affected lung. What is flail chest means? Flail chest occurs when fracture more than three contiguous ribs in two or more than two locations. Three contiguous uh, flail chest occurs when fracture of the three contiguous ribs in two or more than two locations creates an isolated chest wall segment, flail segment that moves paradoxically opposite to the rest of the rib cage during respiration. Typically, the extreme trauma Typically, the extreme trauma to the chest wall that creates the flail segment also contuses the underlying lung, causing diminished anterior breath sound beneath the anterior flail segment. Flail chest can cause hypoxia due to impaired generation of the negative intrathoracic pressure, during inspiration. Impaired generation of the negative intrathoracic pressure during inspiration, pulmonary contusion in the underlying lung, impairs oxygen diffusion, fracture related pain causes respiratory splinting, decrease inspiratory effort, and bivascular atelectasis. So flail chest, three or more than three rib destruction in two or more than two locations, that is flail. Three or more than three contiguous rib destruction in two or more than two locations. It may be due to impaired generation of the negative intrathoracic pressure, pulmonary contusion, fracture-related pain causing respiratory splinting, and bivascular atelectasis. Flail chest often results in respiratory failure, required mechanical positive ventilation, which is due to positive pressure and can force flail segment to move upward with the rest of the rib cage during inspiration. Rib fracture. Isolated rib fracture with an evidence of chest wall deformity or internal organ injury. Internal organ injury pneumothorax can cause sufficient pain to result shallow breathing. Small tidal volume atelectasis increased risk of pneumonia. If there is rib fracture, as pain occurs during inspiration, so patient tries to inspire slowly or consciously to relief from the pain and thus causing atelectasis and increased risk of pneumonia. This shallow breathing, small tidal volume can cause atelectasis and pneumonia. Frequent complication of the rib fracture Prophylactic antibiotics are not routinely indicated. In here, the problem is the pain. So why we are giving antibiotic? If I have already discussed, if refracture level 1 to 2, level 1 to 3, think about subclavian vessel, brachial plexus, and mediastinal vessel. If reef fracture 1 to 3, think about subclavian vessel, brachial plexus, and mediastinal vessels. If 3 to 6, think about cardiovascular. Any sort of cardiovascular waves. Reef fracture 9 to 12, intra-abdominal organ should be looked at: liver, right side, left spleen, left side, kidney, posterior ribs 11 to 12, and pulmonary, any level. In pulmonary problem can happen in any level of the. Okay, after significant associated injuries have been ruled out or treated, the mainstay of the rib fracture management is a pain control, NSAID, and opioid to ensure appropriate ventilation and adequate cough for treatment who require hospitalization, and for more extensive refraction, intravenous analgesic, IV analgesic, and regional anesthetics, epidural infusion, intercostal nerve block may be added. In addition to pain control, patients should be taught more importance about pulmonary toilet, the use of pulmonary toileting, and the use of incentive spirometry. This is what is very important. Incentive spirometry should be used in rib fracture. Rib fracture typically healed without surgery, usually non-displaced fracture. Surgical fixation is indicated only for severe cases. Only for severe cases. That means flail chest with failure to wean from the ventilator, and significant chest injury. Percussive chest physiotherapy can loosen thick. This word is again another important. Percussive chest physiotherapy can loosen thick secretion in the lungs and facilitate removed by coughing. Although patients would benefit from pain control and to ensure adequate cough, there is no evidence of thick secretion that require percussive physiotherapy. Now, diaphragmatic rupture. Blunt thoracoabdominal trauma can cause diaphragmatic rupture by a sudden increase in the pressure that creates large radial tears and avulsion from sidewall attachment. The diaphragmatic defect allows migraine of the intra-abdominal content into the chest. That means diaphragmatic hernia, resulting symptoms due to lung compression, respiratory distress, bowel obstruction. Diaphragmatic hernia leads to lung compression, bowel obstruction, lung compression, came with the complaint of respiratory distress and bowel obstruction, nausea, vomiting, abdominal pain. Most patients with diaphragmatic rupture require immediate treatment, often associated with injuries. Some patients, usually in children with traumatic diaphragmatic injury, may initially have no symptoms and can present in months to years after progressive compression of the diaphragmatic defect. Chest X-ray may not. Chest X-ray may show elevation of the diaphragm. Chest X-ray may show hmm, chest X-ray may show elevation of the hemidiaphragm or abdominal organs in the thorax, but is typically non-diagnostic. CT scan of the chest are usually required to confirm the diagnosis. Dissection of the chest is required to confirm the diagnosis. Patient requires surgical repair because diaphragmatic hernia can potentially result in intestinal. This one is very high. Also, diaphragmatic hernia can result in intestinal strangulation and death. This is herniation of the bowel loops in the thorax. This is herniation of the bowel loops in the thorax, and rightward shift of the heart in the mediastinum, rightward shift of the heart in the rightward shift of the heart in the mediastinum, and in here, herniation of the bowel loop into the thorax, herniation of the bowel loops into the thorax, herniation of the bowel loops into the thorax. Okay, thank you for the thank you for listening. Hope you enjoyed.